fact versus the day of.
This meeting is being recorded.
Hey, Anna, you're kind of dark there.
Let me see if I can change my curtains.
Yeah. Trying to think of what's behind me. We just had a party for my, oh, this is recorded.
I'll go ahead and get us started on Facebook. Hang on one second. I'll give you the go live.
It's best I can do.
Is Dr. Waller here yet? He'll join us.
Yeah, he's in the process.
Right, it's like, this is ridiculous. I have Scripps card. Charge Scripps card. Why would you not let me eat the food the Scripps is already paid for? We're not regular media, we're special.
And we're live on Facebook.
Excellent.
Welcome everyone to the Center for Closing the Health Gaps Town Hall meeting. Today we're going to talk about a really important topic that's often overlooked. And that topic is caring for the caregivers. So our society has several definitions of caregivers. For the purpose of this panel discussion, caregivers are people who regularly provide care or assist a senior who cannot independently fully care for themselves. They help with household cleaning, finances, cooking, making appointments, transporting or arranging transportation, physical and personal care, and so much more. Research shows that many caregivers neglect their own health while caring for a loved one. That's why we're doing this panel. So caregivers are at a much higher risk for diabetes, depression, substance abuse, stroke, and other illnesses compared to other professions. So these factors, as you can well guess, increase the mortality of caregivers. There was a study done in 2017 called Racial Differences in Caregiving, and the study showed that Black and Brown caregivers spend more hours a week caring for a loved one in comparison to white caregivers. So they experience more stress, more strain, and worse health. The Center for Closing the Health Gap in Greater Cincinnati has conducted research to better understand the thoughts, the feelings, the attitudes, and the stressors associated with being a caregiver in Hamilton County. And I should say their findings are in line with the national literature. So this research was the foundation for the program that the Center for Closing the Health Gap developed, especially for caregivers of color. So this program is designed to support and care for caregivers through a 6-week interactive program that addresses many of the issues that caregivers shared in the research. And we'll remind you a little bit later, but to find information and to sign up and to learn more, go to closingthehealthgap.org/caregivers. And let me add, there are multiple sessions. Okay, so anyone who's not on the panel, please mute. We can hear you coming through. We're glad you're here though. We have a stellar group of panelists. Okay, someone has to mute. All right, we're gonna try to talk through it. Okay, there you go. That's better.
Okay.
We have a solid group of panelists, and I'm going to ask each of them to introduce themselves and give us a brief intro to the organizations that they represent. All right, so panelists, let's just go in the order that I have here. Dr. Paul Waller, Tracy Sipple, Anna Gabo, and we have Melissa Deaver. Okay, so let's start with Dr. Waller. Quick introduction. I think that was my mic that was echoing back there. You never know, tech issues. Okay, Dr. Waller.
Hello.
Hi. Give us a quick intro about yourself.
I'm hearing double. I don't know if I'm here.
Wow, maybe we should,
Dr. Waller, it looks like you're connected twice, so you need to
oh.
pull one of them.
And we're gonna fix the second.
Okay, great.
There
Thank
we
you.
go. Okay, all right. That is great. Okay, Dr. Waller, give us a quick intro.
Can you hear me?
We can hear you perfectly. Can't see you, but we can hear you.
I am Dr. Paul Waller. I am practicing here in Cincinnati. I originally trained at University of Cincinnati and then Bethesda Family Medicine. I've been practicing here in the city for 34 years. I am presently one of the lead physicians for Marathon Health.
All right, thank you so much. Okay, Tracy Sipple.
Yes, my name is Tracy Sipple. I am, I spent a lot of time in corporate America before I decided I wanted to be a therapist. So I am now a mental health therapist in my own practice, New Leaf Counseling Group, where I see a host of people, including caregivers. So I'm glad we're having this conversation. My work with the Health Gap is really focused on this project because we did research to really understand what is the need. And only because of conversations in the community, we even recognized that this was an area where there was more need than we recognized. So it's a great thing that what we're doing here is really figuring out how we can care for our caregivers.
Yeah, so important, so important. Okay, Anna, with the Council on Aging, Anna Gabo.
Thank you. My name is Anna Gubo. I'm the caregiver support nurse with the Council on Aging. If you're not familiar, the Council on Aging is a nonprofit. We provide services to our seniors to keep them at home. I personally meet with caregivers and provide them whatever support, information, resources I can to make sure that they get what they need. I've been a caregiver, so I understand the plight of being a caregiver and not even recognizing that you're a caregiver. So it really is important to me to reach the masses and let those caregivers know there is support, there's education, there are programs meant just for you as a caregiver. So hopefully we are reaching out to all of those people.
And we are going to talk about those programs a little bit later. So thank you for that. Melissa Deaver, Alzheimer's Association.
Yes, hello everyone. I'm Melissa Deaver, the program director for the Alzheimer's Association with the Greater Cincinnati chapter. I'm a licensed social worker and I've been with the association for 12 years. And I've been a social worker working in the field of geriatrics for about 25 years. So totally understand what caregivers go through and have been, a lot of my life's work has been involved in that. So happy to be a part of this and try to help our caregivers.
Thank you so much. Okay, so let's start by talking about, Dr. Waller, I'm going to throw the first question to you, and that's what medical issues have you noticed about caregivers?
Well, I think that we must realize that as the population ages, the baby boomers.
You know what, Dr. Waller, I think you're logged in twice.
I'm logged in twice.
Yeah. Do you want to just mute for a second, check your login? And then, okay, we're going to come back to you, okay?
Okay, all right.
All right. Just check and make sure you're not logged in twice. I don't know if we can check this real fast. Are the tech people still? Oh yeah, you are logged in twice. You're on here twice. So there's maybe hit a screen. Well, okay. You'll figure it out. I won't do tech work. We're going to come back to you. Okay, So Tracy, let's talk, we're going to have Dr. Waller come back and talk
Okay.
about physical issues, but let's talk about some mental health issues that you run into it in your practice, some commonalities among caregivers.
Yeah, quite a lot of depressive symptoms. Caregivers, as you said, don't really realize the toll it takes to care for their families, do their jobs, and then care for someone they love. They often feel inadequate. They feel like they should be doing more, could be doing better, by them, and it's never enough. So it's quite overwhelming. Oftentimes we talk about, means by which they can carve out a little time and set some boundaries and figure out what help they have available to them. Because many times they'll, oh, well, nobody can, it's only me. And the fact is, it's not only you. These women on the phone here, Melissa and Anna, and just do great work in the community. A lot of the program that we developed was really based on their models and some of the literature that they've already created, because we know it's there. I think the challenge with people of color is that they don't really feel like they see a group and they don't see anybody look like them, so they don't partake. And so missing out on some really good information. Like Anna, I am also a caregiver. So, and I did not know I was a caregiver until I took on this project. So it's just something that you don't really realize. And another commonality that I see is that the people everyone else comes first, which is good. It's admirable. It's what caretakers do, but it's necessary, absolutely necessary to care for yourself. It does not make sense for you to die before the person that you're caring for. So the investment is necessary, the time that you take for yourself.
Yeah, that sounds like there's a certain amount of guilt that goes with being a caregiver.
A lot of guilt.
Thank
you.
Yeah.
A lot of guilt, and even the idea of what's enough. If my mother's unhappy, and just be, no matter what I do, right, it's still a level of, is this enough? And a lot of guilt. And clients often talk about, I'd rather be tired than have the guilt. And that's a choice that is more detrimental than they know. Yeah. So we truly try to work through those issues to say, how do we fit you in?
Yeah. Okay, Dr. Waller, I think you've gotten the tech issue resolved. So tell us about some of the commonalities that you have seen among caregivers.
Again, as the baby boomer population has aged, a lot of us have found ourselves being caregivers. I think it's even, I went through this experience with my own mom. I think that it strains the individuals and even resilient people. Most people who become caregivers a lot of times don't even realize that it's affecting their own health. And becoming caregivers, you have to really work hard to preserve your own health. High risk factors: female, lacking formal years of education, living with the person that you are the caregiver for, social isolation, increased risk of depression, financial difficulties, the high number of hours that you are solely taking care of those individuals, not having coping skills, not having respite and a support system, social support system, family support system. All of those things impact the caregiver population today. And it can have a profound impact on the caregiver's mental and physical health. Yeah.
Oh, I'm sorry, go right ahead. No.
I had a personal experience of even when we took care of my mom as she aged, and I was fortunate enough that I had siblings, and we wanted to keep her at home and not have her in a nursing home situation, and we did not have respite. And it was very taxing on me and two of my siblings taking care of my mom as she progressed and became worse in her health. And that was with three of us. I can't imagine the stressors of it, of being in a one-on-one situation where you are the sole caregiver for a grandmother, a mother, or family member at your house. But it's occurring more and more as the baby boomer population ages.
Yeah, I was going to say, just thinking about so many couples, I know older couples where one member gets sick, the spouse cares for that sick individual, and the spouse, the caregiver, ends up passing first, and everybody's shocked. And I've seen that happen a number of times. And now that you and Tracy are talking about what's going on with caregivers, it's starting to really make sense. I can understand that. Melissa, I see you shaking your head, yes, in agreement. So weigh on in.
Yeah, absolutely. I mean, everything they're saying, we even have, research and statistics that show just exactly what you said, that the caregiver often passes away before, in our case, we're talking about, of course, dementia, but it's across many diseases, but passes away before the person with the disease because they are so stressed. They're not going to the doctor to get themselves, checked out. And, if anybody, listening, is a mother, many mothers can identify when we are in the throes of caring for young children, we don't take time for ourselves. We don't get ourselves checked out. And that's what happens with caregivers. And then what we often see, even if they do outlive the person that needs care, often when that person passes away, the caregiver, all of a sudden, boom, they're having a heart attack. They found out they have high blood pressure. All of it comes crashing down. And then they realize the toll that, caregiving really took on them. And also something I wanted to mention that Dr. Waller was talking about, talking about the baby boomers aging, and I myself am a caregiver as well. I have children at home that I'm caring for, and of course that I'm working. So that puts me in the sandwich generation. Right. And that's something that we're going to see more and more of, are people who are still working, taking care of children, and now they're taking care of, mom or dad, or maybe husband or wife if they have early onset Alzheimer's disease. So, that even impacts what we even look at from the Alzheimer's Association, is looking at how that impacts employment and our workforce. And we're even having issues now not being able to get people to fill jobs. And if things don't change with providing more support for the caregiver, I think we're going to lose more experienced people, because we're talking about people in their 40s, 50s, those experienced workers that are going to be leaving because they don't feel like they have a choice. So I think that educating caregivers and letting them know what's out there benefits caregivers, but it also benefits us as a society.
Right. Now, let me ask you, because we're talking about personal caregivers, people caring for their families. Does the same data apply to those who are paid caregivers? Or is this only for personal caregivers?
Well, I think the paid caregivers typically are not of family, right? So there are caregivers who are given a stipend or something like that, a nominal kind of pay by the state. But even those people is not a lot.
Okay.
It's something that will help with gas money, for example, but it's not a lot. So it's not truly, I wouldn't think there's a big difference, but I don't really know. Melissa.
Okay, that's something to look into. But okay, so let's see now, Anna, we haven't heard from you, so weigh on in. What do you think? What are some things some physical or mental issues that you've noticed in caregivers?
Yeah, I ditto everyone's comments so far, and it's what I see every day. What, a lot of caregivers, they just put that person in front of themselves. And I understand that. I've been a caregiver, I've been a mother, but please put that oxygen mask on.
Right.
That's what we're asking the caregivers to do, is put that oxygen mask
Yes.
on. Allow yourself the chance to, take care of yourself so that you can continue to care for these loved ones. And, it's interesting, the paid versus unpaid caregivers, because I've been both. And my just personal experience is it's so much more difficult when you're talking family. So, being an unpaid caregiver at the time, I was not trained, which most of our caregivers don't receive any type of training. So, that in itself is an additional stressor that paid caregivers probably had some training to learn how to care for an individual. And also they're usually there for a short period of time, 3 hours, 8 hours, they get to go home at the end of the day.
That's right. Yeah.
These
Oh, you're talking about
caregivers-
outside care. Yeah, so there's a difference. Thank you, Anna, for making that distinction. There's a difference between outside care where you bring someone in versus a family member being paid a nominal fee or a nominal salary or a stipend to care for someone they love. Very different situation. And you're right. And then, what we run into is that even when you do take a part of those services, there are different people come every day, and your mother is, who is
It's
this
not
person? And, we
perfect.
already have an issue with dementia. So how can you then introduce someone over and over again? So the challenges are really real. What I try to tell my, the people I work with is, set boundaries. We use that word boundaries in a negative term sometimes, but even a boundary to say, I am going to pick up the phone starting at noon versus 8 a.m. or 6 a.m. I am going to, not stay for the afternoon like I want, like what I've been asked, but I'm going to do. And, I'm going to stay for 2.5 hours and I'm just going to go have dinner myself. Just little things make a huge difference when we put ourselves at least at par with the people we care for.
Yeah. And I'm just thinking that guilt factor though.
No, it's
Yeah.
real.
It is
It's real.
Well, let's talk about, so Tracy, now you were involved with some research that the Center for Closing the Health Gap did concerning caregivers. And from that research, the center developed a program for caregivers. Tell us about that.
Yeah, so we're about to launch the pilot next week. And then we're going to have many other sessions in different neighborhoods. So what we found is that your pool of people, whether it's family members, whether it's outside help, even that takes some construction, right? And so I know as a caregiver, when I didn't know I was a caregiver, I was trying to figure out what's my options, and how do I do this, and how do I do this? And so what this program is really designed to do is to take all that away for the caregiver in a setting that's in their neighborhood, where they will learn over a 6-week period and hopefully have a good time. That's my goal. As far as, from a doctor's perspective, for how you about communication, about disease states, caring for them, about wills and all the things that we have questions on. We're going to have experts in the room to help us provide that kind of overall information. And the best part of this I love is that I'm hoping to create community within these neighborhoods. These caregivers are going to know each other and hopefully lean on each other in the future. So we are going to do what we can to facilitate that. We are trying to address all the barriers. So transportation, respite care. So having someone sit with the care for a person, or somebody that is the same person for 6 weeks. Imagine that, right? And really, let it be a time for the caregivers can not only learn, but they can realize that they have community, that they have help, that there are resources out there that can aid them in getting, through and almost, imagine this time with these people that we love. it's different, right? So I'm looking at my mother's face these days and it's a little different.
Yeah, yeah.
Than I remember. So, even that as much, it's really powerful to really understand what the options are. How is this feeling that is all this guilt okay? Is me feeling tired and resentful, is that okay? Is that something that is normal? And we just want to get people in the same room. And
I
so I'm
love
really
that.
excited about this program.
Yeah, it sounds like, Dr. Waller it reminds me of what you were saying, that caregivers often experience a sense of isolation.
Mhm.
And so, yeah. Do you want to
Yeah,
talk?
we're
about
trying
that?
to
Yeah.
kind of create a sense of community. So as much as possible, we're going to have these 6-week groups in different neighborhoods, very targeted neighborhoods. And so if you go to closingthehealthgap.org/caregivers, you'll sign up and then we'll place you in whatever cohort makes sense for where you live and the timing for the remainder of the year. So we're really excited. And these lovely ladies will be on our team, and we have a specialist, and we have the people in the room who have the knowledge. So that's huge, right?
That is so important.
All in one place.
So now, Anna, let me ask you, because I know that the Council on Aging has partnered with the Health Gap as well. So tell us about that partnership and why this is so important.
I cannot reach enough caregivers on my own. And, I cover 5 counties in Southwest Ohio, and it's not to say that I'm not busy, I am, but there's so many more caregivers out there, and working together, partnering with the organizations that are local that can help get the word out. There's something that Tracy might be able to lead me on to for a caregiver. There's something I might give to Tracy for some of her caregivers. It's all about the community and working together. I think at the end of the day, all of our goals are the same. We want these caregivers to be taken care of. Yes. And, I may not have every resource available, but I bet if I call Melissa, she might be able to fill me in on something, or Tracy, or,
yes.
And it's that same community for the caregivers. If they come together and meet one another, to have that support and know, oh my gosh, I'm not out here drowning all by myself, because you feel like you're drowning as a caregiver very often. And just knowing that, maybe somebody will see this and say, hey, there's support available, or hey, mom, there's somebody available to talk to. There's resources out there. Let's just check into them. There's no cost to look. It's not a perfect world. I wish we could say, oh, we can get respite in place and it'll be the same aid coming. The unfortunate part is it's not that way right now.
And it's interesting, even when you private pay, that's even a challenge.
Absolutely.
So, I've been run into stuff. Yeah. So it's just a challenge.
Melissa, let me ask you about the Alzheimer's Association. Now, you also partner with the Health Gap, but you also have other programs. Tell us about some of the programs you have to help caregivers.
Sure. And I was just going to quickly say that, our reason for partnering is much the same that Anna discussed. We want to reach more people. We know we're not reaching enough, and we particularly want to reach folks in diverse communities, because specifically with Alzheimer's disease, we know that African Americans are more affected with Alzheimer's disease than any other ethnicity, but we also know that African Americans are least likely to be diagnosed. So it is so,
I didn't know that.
I did not know that.
Yeah. So it is so, because a lot of the mistrust with medical systems, physicians, all of those barriers, all of those things that go on when we talk about diversity, equity, and inclusion. So, we're really committed to getting out and doing this, because it's so vitally important. But yeah, some of the programs and services that we have to offer, of course, we help folks with any kind of dementia. So it's not just Alzheimer's, it could be vascular dementia, it could be Lewy body, it could be dementia because of Parkinson's, so many types of dementia, but any kind of memory impairment really. Or you just need to know, is this normal? And if it's not, then well, where do I go and what kind of test do I ask for? So we have an 800 number that people can call even at 2 o'clock in the morning. If that's the only time you have to call, or maybe your loved one is trying to wander away and you need help. So we have a 24-hour helpline number. We do family care consultations where one of our nurses or social workers meet with families to help them understand the disease, what to expect next, and then to start care planning. What is out there to help me? What do I need to think about now? What do I need to think about for the future? And how do I keep myself from getting in a legal and financial mess, because that happens very often.
Yeah, I bet.
And how do I deal with the behaviors I'm seeing? So we address all of that. Caregiver stress. We have support groups for caregivers dealing with different types of dementia. We have lots and lots and education programs that we do virtually and in person, because educating the caregiver is what's going to allow them to continue to be a caregiver, because many people often do have to place their loved one because they can't deal with the disease and often don't understand, how do I deal with this?
Yeah,
Right.
I was just thinking with Alzheimer's, and I don't mean to compare and make one thing worse than the other, but it seems to me that when you're dealing with the memory loss or the mental impairments, that must be super, even more frustrating for the caregiver. I think about my uncle and aunt were both in their 90s. My aunt had Alzheimer's, and my uncle just, would just get really upset when she would, ask, how her parents were they coming to visit her?
Right.
And, and I said, she can't help it. And dealing with that was so difficult. And I can understand that, but that extra layer, so it's not the physical, it's the person becomes someone different.
Yeah.
Yes. Yeah. And I think too, it's that, physically the person is there, this person that you've always known, and you want so badly for who they used to be there, and they're not. And so you're struggling with that loss. And, with this disease, there's loss all along the way. So you're struggling with losses every day. And I think it's just this continual grieving process.
Absolutely.
And I wanted to mention, thank you, Melissa, for talking about the care plans. That's also a part of this initiative, is that everyone's going to walk home with a care plan, and for themselves and for their loved one, like really trying to figure out what are your resources and how can we get them the help they need.
And, so Melissa, you brought up African-Americans and not being diagnosed with Alzheimer's disease, which, I didn't know about that, but that just makes me think about, are there differences in how, people of color who are caregivers deal with these programs, or deal with self-care? Dr. Waller, let me start with you to ask you about that. Do you see any differences in your patients, for example? And I don't know if it's a cultural thing or not, but in terms of.
Well, I think that, again, it depends on your level of formal education. And if you have any idea, I think a lot of times individuals who become caregivers don't even realize at that time that they're becoming a selective caregiver. They lived in their family units and they're there. The individual becomes ill. They develop dementia. They develop other medical issues. And here they are, already a caregiver, not really looking at it. It's just, hey, in my family, we take care of each other. And it is very easy for you to get into a situation where you, again, become socially isolated. You are here trying to take care of aunt, uncle, grandparent, spouse, and you quickly become overwhelmed. not having the support system, not having the financial resources, and not really knowing the disease process well enough to understand that this individual is slowly making a downhill spiral or a downhill progression toward the end. And the irony in it is I've seen people with dementia who you would think that they would make the rapid progression and leave here in 6 months. I've seen people
Oh,
live
no.
for a year and a half to 2 years,
Dr.
much
Waller,
more
you're
rapid.
2 years.
Oh, here
Wow.
you are. Are you back, Dr. Waller? Are you
Yeah.
back?
Mhm.
Yeah,
Okay, we lost you there just for a second.
yeah. I've seen people be diagnosed with dementia and live for 2 to 3 years, and I've seen people be diagnosed with dementia and make a rapid progressive decline and be gone in 3 to 6 months. And you
Wow.
never know. You
Yeah.
never know. And again, just the taxing aspect, if you're a sole provider and you don't have adequate support and respite, I mean, you can't sleep, you can't rest. I mean, personally with my mom, we were tag teaming and spending the nights with her, and you don't sleep because you're not REM sleeping. You're there watching this individual, listening. So it just wears on you. And the idea that if you have to do this 7 days a week, 365 days a year, your health is going to decline. I don't care who you are.
Right. Yeah, you're not
Yeah.
sleeping. My goodness, yeah. I was gonna say my aunt had Alzheimer's for like 15 years. I mean, it
Oh,
was,
wow.
yeah, it was a long,
Yeah.
long struggle. So that was rough.
I do want to speak, can I speak a little bit about the cultural
Tracy,
difference
go
that we saw a bit?
Yeah. Uh-huh.
You know, particularly with respite care, you know, or any kind of help really, is to say, well, you know, that's not really for me, right? That's not for me. They won't get it. It's a little different because of, you know, and in my community and my family, we take care of each other. It's not, it's a taboo almost to allow someone else to do it.
Right.
And so those, you know, that's again, that's what the guilt plays into also. But it's not an either or, right? It's an and. How do we adjust? How do we make it okay so that all parties involved, the caregiver, the person who's being given to, and the family, how do we all make this as easy as possible and not as taxing?
Yeah, that's the key. Absolutely. And I wanted to get back to the whole racial thing, because I understand, and you know, Dr. Waller mentioned some cultural things, but I understand that people of color typically don't participate as much in caregiving programming. And I just
Sadly, that is true. And what I see is, you know, there's that, Tracy had mentioned that family responsibility that's taken on. And, you know, and I see that very strongly in the African American community, as well as the Latino, Hispanic community. You know, those individuals, the Asian Americans, again, that was ingrained. You take care of your elder ones. And they almost don't feel as if they have the right to ask for
Option,
help.
absolutely. Yeah.
So getting them to understand that you do have a right to ask for help, to ask for respite. You know, you don't have to do this all on your own. I don't know how to make that cultural shift because it's so ingrained.
And I think that is why we're doing this program, is so that it's coming from people that look like them to say it's okay. So if it's not, you know, respite per se, how do you tell a family member when they say, well, what can I do? Let me know what I can do. Pick something. You know, always have a list. You can take there this hour, you know.
there's lots
you know,
to do. Right?
There
Yes,
are a million
and
things to
accept the
do.
house.
Pick some of them.
Something.
Pick something,
Yes,
you know,
anything,
like-
whatever you like.
Right.
Garbage, cooking, you know,
Yes.
care,
Maybe just leaving
whatever.
the house if people wander
Yes.
off. I mean, sometimes some folks have to be watched. And so, just having
Right.
someone there while you take a break.
Yeah, I realized like maybe 4 or 5 months in that I kept telling people, no, I got it. Like, but why? Why? And people were asking me, but I thought that was my responsibility. I didn't have a choice. I felt like I did not have a choice. So as again, doing this work really enlightened me, and talking to these women really helped me to decide what I'm going to be as a caregiver. What role can I play that's not doing as much damage to my children at home, right? That take it away from and starting a business and all this jazz. I mean, there's enough work for everybody.
Yeah.
Well,
I try to tell people, if you're not taking care of yourself, you won't be here to take care of this person you really love.
That's
You've
absolutely
got to
true.
take care of yourself, but that's just a really hard message. That's a hard
it
message.
is hard one to accept too.
Yeah. So I think, Tracy, back to what you were saying, I think the groups, does that help to be in a group with someone like yourself who's a caregiver, and to be able to, tell each other, stop feeling guilty. We're just gonna, we're gonna do things differently now.
Yeah. And, as a therapist and doing all this work, I do not belong to a group. So, and so I'm looking forward to actually, being a part of a group, because I don't know. I think I'm a superwoman, perhaps. I'm not sure, but I just think if I have it. Like,
You probably are.
I just wish I knew some of the things I know today. I wish I was making 1,000 phone calls when I would have known to call these 4 people. The Council on Aging and Alzheimer's Association, they literally talk to people. I mean, it's not like a phone service, and they care.
Yeah.
So I want to make that a part of this, and so we're going to set these communities up and these cohorts of people so that they can continue. And if they want a group that needs to be facilitated, we're gonna honor that. We're gonna figure it out.
That's
Hamilton County was very gracious in their award of this grant, because they recognize the need, and so we're gonna make sure it happens.
Yeah, I think that's fantastic, and it's starting next week. You're saying, right?
Yes, well, the pilot is. So the program starts full speed in July, and so it'll be we're doing a couple of them simultaneously, and a couple of overlaps, just so we're in a community. I'm sorry, there's like a bug walking toward me. But now I got it.
We got tech issues, bugs. It's all right.
Before I forget my thought, can I jump in here about
Yes,
groups?
please.
One of the things that a lot of the caregivers that I meet with say, oh, a support group, I don't want to go and listen to everybody's problems. And I'm just here to tell you that you're not sitting there listening to everyone's problems.
Right.
They all know the problems. We are all having them. What you are talking about, though, is how do we fix those problems?
Yes.
What did you do that worked for your mom that might work for my mom? Because especially in dementia care, something may work once, it may not work ever again, or it may work continuously. You just have to be creative. And the one thing I personally garnered from going to support groups was the information. Call these people, do this thing, try this thing, and when you just can't take it anymore, it's okay to scream, because I did that 20 times yesterday. So for those people who may be on the fence about, I don't know about a support group, believe you me, you will be pleasantly surprised. And I'm sure Melissa can vouch for me with their support groups. You get so much more than that out of it.
You know what? I compare it to being a mom in elementary school, and you have your mom group. How do we do potty training? How do we get them to read? It's the same thing, building community, so that we can.
It's a community.
Yeah.
Well, and I was going to jump in exactly off of what you said, Anna, that, so many times caregivers feel like that they can't go to a family member. They don't want to burden them, or they don't want judgment. from somebody else because, I got so tired of answering that same question. I lost my cool when I yelled at them. Because somebody else who's not dealing with that disease might say, oh my gosh, I can't believe you did that. But those people in that support group are going to go, oh yeah, I've done that 100 times. Or, sometimes I feel resentful. And you can say that in those groups, but you can't say that to everybody. So it's a place where you can really express what you're feeling and be free of judgment, because those people there have felt everything you're feeling. So there is nothing you're going to say that is going to be shocking, that you're going to be judged for. And I think that's, what really makes the group also important, is because caregivers often don't feel like they can talk to friends and family members about how they're really feeling.
Yeah, people don't get it.
Yeah, I love that. It's a judgment-free zone. You
Yeah.
can just
Very much.
be yourself, let it all out. And you're right. There's some things you can't say to other family members. They'll think, oh, you don't love your mom. What do you mean? You get
Right.
frustrated with her, because she asked you the same thing 10 times, in like 1 hour. So yeah. Okay. I think that's wonderful. Okay. So let me ask you guys about advice. Dr. Waller, I'm going to jump back to you. So what advice would you give caregivers about managing the responsibility of being a caregiver? I would say even about stepping into the role of caregiver.
Again, I think that with the statistics showing that 1 in 3 adults now are being placed as caregivers with the baby boomer population aging.
That's a big number.
That is a big number.
Yeah.
1 in 3?
You really, 1 in 3 adults. You don't have time to plan.
Right.
And I think it's very difficult as population of individuals are living into their 80s and 90s. It is impacting families a lot more. And with the aspect of the family unit, not, 2 generations ago, the family unit would be in one city, all the cousins and everybody stayed in that city. And now people were all over the country. So you have siblings that may be on the East Coast, West Coast, wherever. So a lot more people are being placed in the situation where they're one-on-one being that caregiver. My big advice would be to learn that we're now having these programs and having the information where individuals can go and get help, and individuals can get respite and even possibly financial assistance where they're not being isolated, they're not being depressed, they're not being pigeonholed in the situations where they can't go to their doctor's appointment. They have diabetes, they have hypertension, the caregiver, and they haven't seen a doc in 1.5 years. So having these support programs and these initiatives to allow individuals to still be able to go to the doctor, to get some respite, to do that will make a profound impact on protecting the caregiver's health as they are embarking on these difficult situations.
And that makes me also just think about, and you basically said this, but caregivers have to make sure that they're getting they're not missing their checkups and their annual physical or their dental checkups too, because I think that's part of it. You're so busy caring for the person who's ill that you forget about your own check-in with your doctor. Yeah, so that can be rough. Okay, Tracy, and we've kind of talked about family members, but I want to just say, ask you, what would you recommend to family members of caregivers? How can they help the main caregiver? I know you touched on this a little bit.
Yeah, more than anything, instead of asking, what can I do? Say, I'm going to do. I'm going to do your mom's grocery shopping this week. I'm going to And the caregiver might say, oh, I got it. I'm like, no, I got it. So,
Right.
Yeah.
if family members can, the texts are nice, right? But to say, no, I'll bring dinner today. I got dinner for the next couple of days. What does she
Don't
like?
ask, just do it. Don't
Just
ask.
do
just
it.
go ahead
To
and do
say
it.
what I'm going to do. That will alleviate the guilt, the idea of, no, I got it. I can take care of it. I can do it. I can do it. Because a lot of caregivers, you have to kind of shake us to say, hey, accept the help. So that's my biggest is it's just insist on doing things that matter, that save a little bit of time, and spend some time with that loved one, because they're usually a part of the family.
Yeah, I love that. So Anna, let me ask you, what's your go-to advice when you work with a caregiver? Is there advice you give them?
Well, for every one of them, I just can't reiterate enough. Put that oxygen mask on yourself first. Take care of yourself. Meet your needs so that you can continue to do. But, the one thing I'd be remiss if I didn't say is, caregiving is a lot of stress. It's a lot of work, but there is a lot of joy in it.
Yes,
And
thank you for
any
saying
one of
that.
us who have been a
Yes.
caregiver,
Yes.
you just can't explain the moments, but when they happen, it's worth every stress, every hair pulled, everything that, at the end of the day, when my grandmother passed, it was heartbreaking, but I knew I did my very best.
Mhm.
And I know that someday she would look down and shine upon me. And I do feel like, given the position I'm in now, I'm here for this reason. And, so take care of yourselves, because we can't do it all for you. We can lead you, but we cannot make you drink that water. So please
Right.
take care of yourself and reach out, get help, find what resources are out there.
I love that. And, I want to say that taking care of yourself, this is what I'm learning from all of you. Taking care of yourself doesn't mean you're not doing your best for the person you're caring for. And I think
Contrary.
maybe that's that guilt. That you give it
Absolutely.
all, wear yourself out, you get diabetes, stroke, heart disease, and all that because you're giving everything. That's not where you want to go. You
No.
want to take care of yourself too.
And
And
Anna,
that's
thank you
not
so
where
much.
your loved one went.
Yeah. I just want to thank Anna for mentioning that. There's joy, in what we do as caregivers, and as much work as it is, and as frustrating as it can be. There are those moments that you can capture, and I wouldn't trade it. I wouldn't trade my position for anything. So thank you for saying that. I should.
But you know what?
Absolutely.
Yeah, there's joy, but there's probably more joy when you're creating some kind of balance and you're not just worn out.
Oh yeah,
That is so true.
Yes.
Yes, thank you. Which is why we're here.
That's why
Yes.
you're here. That's why you're here. So Melissa, do you want to weigh in on that advice to caregivers? And I would say especially in your case, advice to caregivers who are dealing with folks who have dementia, Alzheimer's, some kind of mental impairment.
Right. Well, one thing I would say to all caregivers is to make a plan, to become an educated caregiver. That's what you want to be. That's going to be the caregiver that can get through this, that can manage, that can deal, is to educate yourself, find out what is available out there to help you care for that person. Do not wait. Don't think, well, they're not that bad right now. I can wait. No, do not fool yourself. Find out now. Find out what kind of money do they have? What kind of income? How can we make this money last? What kind of care can this pay for? So that you have a realistic expectation of what you can do. And then I would also say to have realistic conversations with your family. Do not assume that, because you want to care for that person, don't assume that your brother and sister or whoever else may, because they may not want to put that kind of commitment. And then you find yourself overwhelmed, and then you're angry every time you watch them drive down the road to do what they want to do when you can't. So I mean, to really sit
I
down
actually
and
hear that
say,
a
hey,
lot.
look,
Yeah.
this is what I want to do. Are you in? And can you do it? What kind of time can you commit? And what will you give me? And really sit down and make a truthful plan about what everybody can do. And the other thing I would say is to be realistic with yourself. Have realistic expectations of what you can do, because people get caught up in emotions. We all do.
Mhm.
And we oh, well, we're just going to do it, but sometimes it's not realistic, and then you end up in a mess, and then you may end up having to place mom or dad, and it was in a facility that you really didn't want them to go to. It didn't go the way you wanted it to go, and it can be so much different if you make a plan. And especially when we're talking about dementia, I can't think of any better gift that your loved one could give you that has dementia than to sit down with them and make a plan as soon as you know they have dementia, involve them in that process, have that conversation, and know, do you never want me to use a feeding tube if you get to the point that you can't swallow and you're aspirating? Don't ever hook me up to life support. Don't put me in XYZ facility. But on the flip side, I've had those conversations with my mother, because my grandmother died of Alzheimer's disease. Her mother died of Alzheimer's disease. So of course it's something my mother fears. And so we've had conversations, and she's told me, honey, I want you to understand something. If it ever gets to the point that you can't take care of me, don't you dare feel guilty for placing me. I know what this disease is. I know what it does. I know what it did to my mom. I know what it did to me as a caregiver. And I'm telling you right now, while I have all my cognitive capacity, if you can't do it anymore, you place me, I don't care what I'm saying. So, I mean, just, it's having those real conversations. So the earlier that you can have them, how wonderful would it be to know that if you have to place somebody you care about, that when they could tell you what they wanted, that it was okay, that you're doing what they wanted. How much peace could that bring you as a caregiver?
Yeah, that's a gift for sure. That's definitely a gift.
Absolutely.
Mhm.
So make a plan, and the plan includes, what happens when or if. It includes finances. It includes your own support system. Who's going to help you out?
Yeah.
Yeah, all those are really important. So let me ask all of you, as we're kind of getting toward wrapping up, is there anything that you want to say that you just want to make sure everybody gets? Kind of your parting words for this panel. What do you want to make sure you tell our audience? And I'll start, Anna, I'll start with you.
I had a feeling you were going to put me under the bus there.
I'm looking
Just
right
kidding.
at you.
There's so much to say. And if you know me, I'm a talker. So, reach out, get to know your resources. As Melissa said, making a plan is knowing what is out there. There's some great resources here in Hamilton County for us to all benefit from. If you're not sure what they are, just start making calls. Get the help that you need. And you may not feel like you need it now, but as Melissa said, if you know what is out there, when the time comes, it's so much easier to understand and access and go through those processes. Because I'll be honest, I've been with the council for 28 years. I've worked in several programs, and sometimes it's not so easy to get into a program and get actual services. So you need to prepare yourself for that. And the sooner that you recognize that you are a caregiver, that's when you need to start working on these things. So if you're, doing mom's laundry, running to the grocery store, taking her to the doctors often, think of yourself. You are a caregiver at this point. So
Right.
start preparing for it
Right.
and for your loved one.
That's great. Dr. Waller?
I think it's very important that we have discussions with our grandparents, parents, our kids. I think it's important that we have discussions about end of life, if A happened to me, if B happened to me, if C happened to me, having living wills, having durable power of attorney, having all of that planned out ahead of time so that when something does occur, you know that person's wishes so that you don't have that feeling of guilt if you start making decisions on this is what mom would want, this is what dad would want, this is what my spouse would want. Because again, it's very difficult when you're taking care of loved ones. Here are people who took care of you, who were strong and were there for you. And as you see them go from being that strong individual to declining, it's like going from being the baby to an adult back to being a baby.
Right.
And here you are taking care of that individual. It becomes very emotionally taxing, physically taxing. And again, unless you have gone through it yourself on a personal level, all the patients that I've taken care of over the years and helped them get here and arranged for all of these things, even though I'm empathetic and it did touch me and I did have stress over it until it happened to me personally with my own loved ones. Oh my goodness, the range of emotions,
Yes.
the range of anxiety, the range of feeling powerless. You know, even as a physician, when that individual started to decline and those changes happened, I could do nothing. There was no scripts that I could write. There was no, I could call in a zillion specialists, but there was nothing that you almost feel powerless. And again, the emotional swings of watching those individuals who were strong, who were there and took care of you, go down that path. It is psychologically, emotionally, and physically exhausting. So we have to have plans. We have to have support systems to try not to put ourselves in the situation where we are the sole caregiver, we are isolated, and we are risking our health solely to take care of our loved ones.
Good advice. Melissa?
Yes, yes.
Wow, I mean, that's, everything everybody has said is great. I mean, I agree with it all. And, the main thing is just to, don't hesitate, reach out, get help, make a plan, and don't think that you're not worthy of having help, because you are. No matter what your background, where you're from, you are worthy of having help, and you deserve it. And it doesn't make you any less of a person, and it doesn't make you love your loved ones any less because you reached out for help. Actually, it makes you love them more because you're going to be a better caregiver.
I love that. That is so
I
great.
know, so true.
Tracy, you get the last word here.
Yeah, I'm amazed. I've learned so much already. I'm just sitting here, the more I talk to about this topic. I think my advice would be community, understand that this is a difficult thing to do by yourself, that, your friends won't understand, your family members won't necessarily understand because they don't experience it firsthand. And that's where community comes into play. And with that community, that is you caring for yourself. That is you putting your oxygen mask on, as Anna said. Right. That is you creating the boundaries that, okay, I need this time. This time is for me so that I can be better at what I do, so that I can be the best caretaker, the best mother that I know I can be. But if I wasn't so exhausted and tired and overwhelmed,
right.
And I just want to plug this program one more time, just to say, we've worked really hard to make sure that it's a program that's comprehensive, that's not boring, that I remember when I first decided to make all those calls that Anna and Melissa was referring to. And I must have called 1,000 people. And with this program, we're going to give you resources, and not just with the program, but we're also making space on our website at Health Gap to make sure that, there's a step-by-step thing. You don't have to figure it out on your own. This has been done over and over. We have great organizations in the community that serve people like myself who is a caregiver and need help.
Right.
And as a clinician, I would say, take care of yourself. So if it's a retreat, I don't know. I mean, people, even taking a walk sometimes is necessary. Boundaries are necessary. What will I do? What won't I do? So that I can stay sane, so I can maintain this level of care that I'm providing today. Because as I get ill, because I'm not taking care of myself, then guess what? The person I'm caring for, my mother, she also pays the price. So it won't happen. So I just encourage people to give it a shot, to see what's out there and understand that this is something you don't have to do alone.
That's right. So we want people to go to closingthehealthgap.org/caregivers, closingthehealthgap.org/caregivers, and sign up. Tell all the caregivers to sign up. There are multiple sessions. These groups are coming to a neighborhood near you.
Yes.
You don't miss it. It's going to be fantastic. It's going to be a life-changing experience, and it will help you experience all the joy, so much more joy that's out there that right now maybe you just are too exhausted to actually experience. So our panelists, you guys are all wonderful. Dr. Waller, Tracy Sipple, Anna Gabo, and Melissa Deaver. Thank you for all your work, and thank you for caring for the caregivers. And Center for Closing the Health Gap, thank you for your research and this new program. We can't wait to hear more about it and to see how it goes. So people sign up. Thanks, everybody.
Great. Thank you.
Thank you.